Good morning, everyone, and welcome to A View from the Hill. My name is Brad Hill, and I am the state representative for the 4th Essex District. And today, we are going to talk about opiate addiction. Opiate addiction on the North Shore is something a lot of people are talking about, and we need to get as much information out into the public about this addiction and what we can do to help those who may be addicted to opiates. And we're also going to talk about things about addictions that may follow opiate addiction. And I'm pleased and thrilled that we're able to have one of our favorite state officials here in Ipswich today, Commissioner Monica Bharel, who is brand spanking new to the commissioner's job at Department of Public Health. She's going to talk to us today about the opiate addiction issue, but she's also going to talk to us about how we can get help out for people who may be addicted to this opiate, explain the situation to us in full so we truly understand it, because I don't think we all do. But more importantly, my hope is by the end of the show, for those of you who may have family members who have opiate addiction, we want you to know that there is help available to you, that it's not something to be ashamed of, that you can reach out to your state officials, your local officials, and there's going to be help for you. We hope that at the end of the day will be what you get out of this View from the Hill episode. Before we start, though, with that discussion, I found out that on your very first day in office was during one of our snowstorms. That's how you were welcome to the state of Massachusetts and the government, was that February snowstorm that we had. So talk to me about your first view and vision of your first day in office.
Sure. Well, it was February 2nd, which seems a long time ago now, but I was getting ready to come in, and it was one of our multiple historic snowstorms. So I think it was over 16 inches of snow. So I live about 4 miles from the office, so I partly walked, partly took the T, but I was determined to get there and get started on my first day.
Well, we're thrilled you're there. You've done a great job since you've taken over the Department of Public Health. Describe the mission of the Department of Public Health and what sorts of services does the agency provide to the people of the Commonwealth?
You know, the Massachusetts Department of Public Health is one of the oldest and most respected departments of public health in the country. And we trace our roots back to Commissioner Paul Revere, in fact, putting up cholera signs so that people were educated about cholera. And the department has a really broad mission, which is to protect and promote the health of all citizens of Massachusetts. So with that, we have services that are really the vast array that span protecting individuals' health. So they include things like surveillance and licensing of nursing homes and healthcare facilities, hospitals, clinics, pharmacies, doing disease surveillance and ensuring that infectious diseases are not spreading, as well as protecting our waters, airs, beaches.
So when we talk about something like the West Nile virus or something like that, your agency would come in and take a look at that issue. I noticed on the news the other day that I think it was Central Mass, actually, there was a case of West Nile virus. So you would be involved in that?
Absolutely. So when we talk about disease surveillance, we really want to ensure that we understand as a state, when you talk about West Nile virus or Triple E as well, which are both mosquito-borne diseases and are very prevalent during the summer months and the early fall months, like now, what we do is we work closely with the Department of Agriculture to ensure that we're trapping mosquitoes across the state and then taking them to our state lab, inspecting them to see if the mosquitoes are infected with the virus, and then monitoring for human cases so that we can help individuals understand where the disease is and how to best protect yourself.
Oh, that's great. How has your background in public and private sector influenced your tenure as Commissioner of DPH so far?
You know, I feel privileged to have served for over 2 decades as a primary care internal medicine physician, and my work has been mostly in urban city areas, and my interest is in helping individuals who are in vulnerable situations. So I find, having trained, I think in Massachusetts we have the best healthcare in the country and the globe. And
I agree with that. For all of those who know me in TV land, with what I went through,
Sure.
with my health issues, I couldn't concur more.
Sure. So when you're sick, you want to be in one of our fine medical institutions in Massachusetts. But beyond sickness, there's so much more to health that includes actually preserving health and promoting and preventing disease. So when I have worked, my work has included working not only in the medical care, but looking at where medical care intersects with community-based care. And at that intersection, where public health meets medical care, is where I think we really have to put a focus on preserving and promoting health for individuals. So my goal is to take a wide-angle look at our public health system and make sure we're doing the most efficient and effective care to promote that health.
That's great. What are some of the major challenges DPH is facing that threaten the Commonwealth's public health, and what ways is DPH using data to address these challenges?
So when you think about Massachusetts, I'm proud to say that Massachusetts is consistently ranked as one of the healthiest states in America. And that's something we should all be proud of. And it really reflects all of us, from the legislators to the government to the public health department, working on good, strong health policy, including things like healthcare access for all. So we really are a healthy state. What I don't want to get lost in that fact is that among us there are pockets of individuals who live and experience a very different Massachusetts. And these vulnerable populations is who I want to draw our attention to. So when you think about health, the single most important factor for health is where somebody lives. So as long as zip code is what determines our health more than any other single factor, there's work for us to do together in the Commonwealth. When we think about vulnerable populations, I really want to make sure that we identify where there are health disparities for certain populations, triage and treat those. And one of the tools we have to do that is having good data. So we collect massive amounts of data at the Department of Public Health, and in this age of big data, I would like us to take that data and do what's called hotspotting, where we look across the state and say, with our limited resources, what does the data show where we need certain services and where we could focus our attention? And then, importantly, look to say, what are the outcomes of our intervention? Because the end goal is to make sure that our citizens are actually seeing these benefits and everybody's having improved health.
Oh, that's great. So the subject matter for today, opiate addiction.
Sure.
It's a big, big issue, not only here in Cape Ann, North Shore, across the Commonwealth, but across the nation. Unfortunately, it's become not only a state issue, but a federal issue. We need to educate the people of the Commonwealth what we are doing as a state, as a legislature, as an administration,
Sure.
how we're partnering together with our police forces and fire departments across this great Commonwealth. So can you explain to us, one, about the opiate addiction in general, but then two, what are we doing as a state to address it?
I want to first thank you for bringing this important issue to your viewers and your constituents, because this is an issue that affects all of us, and the more we talk about it and the better we understand it, the better we'll be able to combat it. So thank you so much for having me here today to talk about this.
You're welcome.
So just to first frame the problem, you mentioned it's a local, state, and national problem. So I read a statistic recently that there's up to 50 deaths a day in the United States from opiates. I mean, if you think about that, that is such a huge number. So this really is a national issue. If we then look at Massachusetts, we just put out data. We were talking earlier about data. So we just put out data on the opioid deaths in Massachusetts. And if you compare the numbers from 2012 to 2014, there's been a 57% increase in deaths. So in 2014, we have over 1,200 deaths predicted in Massachusetts. These are not acceptable numbers. And unfortunately, the trend is going in the wrong direction. So go back to 2004. There were 456 deaths in 2004. And now for 2014, we're talking about over 1,200 deaths. So that is over 6,600 citizens that we have lost, who've lost their lives due to this devastating disease. And that's really one of my key points here, is that this is a disease. It is a medical disease that we need to work together to combat. So given those startling numbers, what can be done? Governor Baker, early on in his administration, put together a group of 16 of us as an opioid working group. We were individuals from across different sectors of society saying, let's start to tackle this problem in a new and innovative way. We went to all corners of Massachusetts and had listening sessions and heard from over 1,100 citizens, as well as received hundreds of emails, read the literature in this topic, talked to experts to put together over 50 recommendations. So these recommendations are connected to 19 action steps, and they span the spectrum of prevention, intervention, treatment, and recovery. And in each of those areas, we have recommendations which we are now working to fulfill so that we can stem this epidemic. The key thing is getting ahead of these deaths and starting to stem and then turn the tide.
So let's go a little further on that. So help
Sure.
me understand, for example, you have the addiction and things of that sort. So how are we going to prevent? Once you are addicted to opiates, what can we do as a state to help? I know, for example, we funded 100 beds recently in one of our supplemental budgets, so that instead of being incarcerated, we're going to get you the help that you need. And that, I hope, will get you on the road to recovery. Can you talk about those initiatives?
Absolutely, and the legislature has been a great partner in working together with this issue. So let's start with prevention. So there's several different types of prevention. The first type of prevention is primary prevention. So we have a key role to play, all of us in society, with helping our children stay away from opiates. So to give you an idea, more than 75%, so the great majority of individuals who become addicted to a substance do so before the age of 17. So if you think about that, our greatest chance for the future is in educating our children. So we are working on tools for parents, for coaches, for teachers to be able to have the tools to do early education so that at an age-appropriate level, children can start to learn what the dangers of these drugs are. There's not enough information out there about what the early warning signs are, so we're working on tools so that everybody understands, so that it's really to prevent the first use.
So as a parent,
Yes.
how do I do that?
So there's a couple of different things. So what the main thing that I would like individuals to know about is that if you go to the Department of Public Health site or to our Stop Addictions site, and you can Google this site, it's a website that has multiple resources. And on that resources, there are resources specifically for parents where you can go, and there are there's literature and information on, say, how do I talk to my child in an age-appropriate way about the dangers of drugs? How do I then look for early warning signs? When we went around on these listening sessions, many parents who had this devastating loss, because remember, the whole entire family is affected by this.
Yeah.
Can you imagine a parent losing their child to this? When they speak about it, many of them said they really didn't know what the early warning signs were, and if they knew that, they could start to think about getting help earlier. But the other piece about prevention is really in the prescriber's office. So when we talk about the number of pills that are out there, most individuals so there's several different types of opioids, and there are opioids that are prescribed by doctors in the doctor's office, and then there's heroin. So a lot is being done and thought about how to decrease the supply of heroin in the state. But when we talk about the opiates that are coming from the doctor's office, the majority of individuals either got the opiate from the doctor themselves or got it from a friend or family member who received it from the doctor. And when we ask individuals, there was a poll done by the Boston Globe in conjunction with the Harvard School of Public Health this year. And they asked individuals, when you receive a prescription from your doctor, does the doctor talk about the side effects, the potentially dangerous side effects of opiates? And only 36% of individuals in Massachusetts said they did. So there is a definite role, and we are working with the medical educators to say, how can we teach prescribers early on, starting in medical school, that we must be able to balance the need for pain relief, because there are many people who need relief from pain, with the public safety issue, so that we're together educating the prescribers as well as the individuals who are receiving the prescriptions.
So when you talk about young kids and getting these prescribed pills, you're talking about if someone is playing a sport, for example.
Yes.
They break their leg, or they go in and they have surgery on an ACL, things of that sort. Next thing you know, they're getting a prescription for like an oxycodone or OxyContin or something of that sort. And what I'm hearing from the citizens that I talk to, you go in there, they give you 100 pills. They're not even giving you like 10 to just see if you can get through the week of this pain. They're giving you a whole bottle fill. So is that the type of or is that the type of conversations you're having with the physicians and the organizations of those physicians? Because clearly that's an issue. I mean, God bless our physicians and all that they do for us. But what I'm hearing and what I'm seeing is that we are getting these prescription drugs given out like they're candy. And that's when the addiction starts. And again, if I'm wrong, it then moves to a drug like heroin because it is so cheap on the market right now. And they want, if you will, that high or whatever they get from the heroin, and then it goes down a path that we all now know about. So, as the commissioner of DPH, explain a little further how we are reaching out to the physicians, because clearly, in my view, and it's only my view, that is one of the biggest problems that we have here.
No, you bring up a very good point, and you're absolutely right about what you're saying. So, part of the issue is when we prescribe an opiate to a patient, you want to make sure that that patient understands the risks and benefits, right? Because if they're in pain, they may need the pain reliever. So when you are taking a pain reliever, one is making sure the individual understands the potency of what they have in that bottle and how to protect it themselves when they go home, and also to make sure that the amount of pills are what is necessary for that person's relief of pain. So there are several things that we're working on to address the issues that you bring up. Number one, the prescription monitoring system. So Massachusetts has had a prescription monitoring system in place since the 1990s. And that system allows for prescribers, so whether it's physicians or dentists or nurse practitioners or PAs, to, when their patient is sitting in front of them, they can log on to their computer and find out if that patient has been prescribed opiates from multiple different prescribers or has recently gotten a large dose of opiates. Then they can use their clinical judgment to decide, is that an appropriate prescription to give or not. That tool is also available to all of our pharmacists. So pharmacists, when they're filling a prescription at the pharmacy, also have that tool. One important thing I want to tell you about the prescription monitoring system is that Massachusetts was one of the first states to mandate that prescribers use this tool. So 79% of physicians are now signed up to use the prescription monitoring system.
And when was that put into place? Recently?
Yes, so that was in the last year put into place. And another improvement that we're working on is the prescription monitoring system, which I've used myself, needs to be better integrated into clinical practice. It's clunky to use right now. So what we're doing is we're committed to a new prescription monitoring system that's easier to use and more incorporated into the clinical flow so that individuals, prescribers, can use it in a way that's effective to help with monitoring what prescriptions individuals get. In addition to that, we are working closely with our colleagues at the Massachusetts Medical Society, Massachusetts Hospital Association, and other groups to say, what guidelines can you put out so that physicians and other prescribers have a sense of how to prescribe, what amounts to give, to your point, and what are the best practices around this. So working really hard with our organizations that interact with physicians as well.
Go ahead.
And the last thing I want to say about that is that we all have a role to play in the number of pills that are out there in unsafe ways. So all of us, I hope that all of your viewers, after you and I speak today, will go home, look at their medicine cabinets and say, do I have any leftover opioids in my medicine cabinets? On Cape Ann, the majority of your police stations have locked drop boxes where individuals can go and discard these medications. I encourage all of your viewers to get these medications out of their medicine cabinets. Do not hold on to old prescriptions. September 26th is National Take Back Day. It's a Saturday. Everyone can go clean out their medicine cabinets, get rid of all medications that they don't need.
Oh, very good. We're supposed to go into a break right now, but we got to keep this conversation going. So, as I understand, and I'm so happy to hear about the new, I didn't know if this had been in place for like 5 or 10 years, and I would have said to you, well, it's discouraging if it's been in that long,
Yes, it's new.
and we're still having that addiction problem, but we'll see within the next year or two how that works out.
Sure.
But now, and hopefully that will help decrease the opiate problem, but let's say now it didn't, and we have a child or a young
Yes.
adult who is now addicted to opiates. How am I, as a parent, going to recognize that? That's another key issue I'm hearing is, and you've mentioned it already, a lot of these parents don't even know that their child is addicted to the opiates, nor do they understand that they're going down a path to heroin.
Absolutely.
So is there any signs that we can talk about today to let parents know what to look for?
So you bring up a really good point. So once we talked about prevention, which is really the cornerstone of us getting ahead of this curve. But then once a child or anybody, a family member, a loved one, a neighbor, someone you care deeply about, is showing signs of addiction, think about this. When somebody starts to show signs of diabetes, or somebody says, oh, I just got diagnosed with diabetes, as a community, we are so supportive of those individuals. We say, how can we help you change your eating habits? Can we go and exercise together? What can we do to help you remain as healthy as possible, given that you have diabetes? When somebody finds out that their loved one is struggling with addiction, it's different. We turn internal. We close down, we shut down, we're embarrassed, we're ashamed, we think of it as personal failures. What I would like us to do is to move away from the stigma of thinking of this as some kind of a personal failure to thinking about this as it is. This is a neurological disorder that affects the brain, where people become so addicted to these powerful medications that it changes the way that they think and the way that they act, and we need to treat it as a medical disease. So along those lines, when we talk about treatment and we think about how to treat individuals, we need to come across it from different angles. So just like in my diabetes example, some people who have diabetes need to exercise more and eat differently. Some people need medications that are pills. Some people need injections, that's insulin. And some people need an intensive care unit. In the same way, depending on where somebody is along the spectrum of substance use disorders, they need different interventions. So just to talk about the different treatment options for a minute. So first of all,
before we do,
yes,
let's take a break.
Okay.
We're going to do a public service announcement, and we'll be back in a minute to continue this great conversation with Commissioner Bharel.
She was that golden child, she was that all-American girl.
He took some Percocet out of my cabinet.
He had been prescribed Percocet after he had the surgery.
My brother started smoking weed, drinking alcohol, taking prescribed medication, and when that got too expensive, he started shooting up.
The group of friends that she was hanging out with changed. She didn't really communicate with me as much anymore.
He wasn't as put together as he used to be.
I'd be like, Brendan, why aren't you going out? Why aren't you seeing the kids? Why aren't you moving?
I noticed his grades were slipping, and he wasn't starting for the baseball team anymore.
He tried a few times, but I think the addiction was stronger and the disease just took over.
We never, ever expected this.
He graduated from Percocets to OxyContin, and then finally he was introduced to heroin.
It's so much cheaper, and it's so available, it's so scary.
As a matter of fact, I caught him, which I hope no parent ever has to do. I caught him shooting up.
I thought heroin, like my beautiful baby boy.
I quickly learned that the drug was controlling me.
So, of course, you do anything for your child.
He went through numerous detoxes. He went through numerous treatment centers.
He would do well for a bit, and then, unfortunately, he would relapse.
In and out of programs, either going to incarceration, and every time he ended up back out in the streets.
As a parent, you grieve the child you lost while they're alive.
They become a stranger to you. We had to hide all medication. We had to hide checkbooks. It was just a horrible, horrible thing, and how fast it spiraled out of control was amazing to me.
I never thought I would be grateful to see my daughter go to jail because I knew she would be safe.
I used to tell my brother, if you keep messing around with drugs, I'm going to end up burying you.
He went down to Florida, was in a program for 8 weeks, graduated to sober housing, and called me on day 60 to tell me that he had 60 days clean. And I told him how proud I was. And on day 61, he was dead.
We're going to have a disabled son for the rest of our lives.
My daughter never expected to become a heroin addict. She never, in her wildest imagination, would think that taking a pill that is prescribed by a doctor would lead her to shooting heroin.
He did tell me that when he had that first Percocet, he knew that Percocet had him.
They found my brother OD'd upstairs in his bedroom.
Brendan was found in a hotel room, and he was gone.
I don't think people understand that trying it once and becoming a drug addict are a lot closer than they could ever imagine.
Welcome back to A View from the Hill. We are here with Commissioner Bharel, and we have been talking about the opiate crisis here in the Commonwealth of Massachusetts. And when we were taking a little break, we were talking about what?
Treatment.
Treatments for those who have an addiction to this crisis. So let's keep on going. It's been great. Commissioner Bharel.
Thank you. So when we were speaking before about what the response is to this and how we'll move forward, we talked about this spectrum of prevention, intervention, treatment, and recovery. And in this model, in the areas of treatment, I want to talk about intervention and treatment together. So first in intervention. So when individuals are suffering from substance use disorder, at some point they could become at risk of death, like the death numbers we spoke about. So if you think about how opioids work, so opioids work first to relieve pain. And as you take more and more of them, there's a risk of them lowering your blood pressure and causing sedation or sleepiness, and then for individuals to stop breathing and to potentially die. So when we talk about the deaths, it's related to this ability of the opiates to stop breathing that is the real dangerous point. We have a tool in our toolbox that I want to make sure everybody knows about, which is called naloxone or Narcan. So when we think about treatment, the first thing is, if somebody is in immediate risk of dying, what can we do? So there's a program that was started in Massachusetts about making sure that Narcan, naloxone, is available more broadly. So I want to talk about that for a second. So there's a form now of Narcan that is nasally administered. So it's a very simple vial to use that you put in a squirt in each nostril that anybody can do. You don't have to be a medical personnel. So we, since 2007, have been working through pilot programs at the Department of Public Health to get this out into the community. First, we started with individuals who were themselves suffering from addiction and making sure that them and their loved ones had this access to this tool so that if somebody found somebody down, they could, while they're calling 911 and getting more long-term help, they can use this medication, which instantly, but temporarily, reverses the overdose. Then we work to make sure that first responders have this, and now are really expanding that program so that fire and police, who are often the first ones to respond to an emergency, have access to this Narcan so that while they're waiting for the medical treatment, they can quickly reverse basically the opioid death so that this tool can help. So it's a really important tool. And I know here at the Ipswich, the police department just started having access to Narcan, and the governor filed for a trust fund for municipalities to have access to that. And through the work of the Attorney General was able to get their company to also fund that. So with the work of the governor, the legislative support, and the Attorney General, we now have a fund so that municipalities can apply to the Department of Public Health to get Narcan at a reduced cost so that we can make sure we have these in our communities. Okay. So that's a really important intervention piece.
And if I'm not mistaken, we had a recent conversation, you and I, with a public safety official from Ipswich, and the fire personnel actually saved a life.
That's
with
right.
this.
So already saving lives here in Ipswich. That's right. So then talking about the treatment. So there are multiple different ways that individuals can access treatment. We know, you mentioned earlier the real need for more beds and the increase of beds that we're already working on. We know that we need more facilities where individuals can go for care. But just to explain what we have right now, we have access to acute treatment services. So if someone's acutely detoxing from opioids, they can get services, and then they can get stabilization services and recovery services. That is often done as an inpatient. However, individuals also sometimes need outpatient care and medication-assisted therapy. Some of these medication-assisted therapies are done at special sites, like where individuals get methadone, and some can be done through a primary care office, like Suboxone can be given through a primary care office. Other individuals need more intensive counseling and recovery support. So based on who the individual is, they access the system at different places, and not one treatment works for everybody. Every individual case needs to be looked at to see what would be the best treatment for them, and do they need acute treatment where they're hospitalized, or can they do an outpatient treatment program instead? What I want to let you know is that there is a hotline available through the Massachusetts Department of Public Health, and if any individual, you asked earlier about what a parent should do or what a family member should do, it's 1-800-327-5050. 1-800-327-5050, and you can call that line, explain where you are in Massachusetts, what your issue is, and the person on the other hand will help find what services are available and somebody to talk to about this. We also have resources available on our website, the Stop Addiction website, so individuals can learn what's available in their community.
Oh, beautiful. So absent the calling the 1-800 the hotline, here on North Shore, here on the Cape Ann, is there a place where we can go, where we can bring family members to get that same information? Do you have satellite offices around the Commonwealth?
So the way that we work and what we really want to promote more of is community coalitions. So where communities say, these are the resources that we'll have in the area, and we want to make sure that individuals can come to them. So for example, there are Learn to Cope chapters all throughout Massachusetts, and these are family members who then can offer peer-to-peer guidance on how to navigate the system because they've had family members deal with this disease. We are also encouraging individuals to talk more to their primary care physicians and providers. If you think about it, going back to my diabetes example, if you have symptoms of diabetes and you're worried about what to do, go and talk to your doctor about it. In the same way, again, addressing this issue of the stigma, we want individuals to feel comfortable going to their healthcare provider and saying, this is something I'm struggling with, help me find the local resources.
And I think what I've started to find, with these addictions and even in mental health, you will start to see that there are many other folks in Ipswich, on the North Shore, going through the same issue.
Yes.
You're not alone. So don't be afraid to go get that help. That's what I'm worried about, is the stigma that you talked about. You and I know you shouldn't have this stigma. You've already talked about how it affects your brain and how it affects your thought process and things of that sort. You're not in your right mind in some cases. So the family members shouldn't be embarrassed by this. They should be understanding there's help. Others are going through the same thing you're going through. There's help for not only those who have the addiction, but also for family members who are going through the issue as well. Which I think is important for people to understand, that there are groups that we can all talk with each other about this as we move forward to get you through what they're going through, as family members.
And I just want to say I couldn't have said that better myself, and I think one of the biggest tasks we have as a society is to work on this issue of the stigma as we start to break down the walls of stigma and think of this as a chronic medical condition for which, just like any other medical condition, we need to support those who are suffering from it, because they really are people suffering from this, and help them into recovery, which is a lifelong process of staying in recovery.
It sure is. I can't thank you enough. We've run out of time for coming to Ipswich, and again, it's not very often that we get a big wig from Boston to come to Ipswich to talk about these issues. But this is such a big issue. We really appreciate you taking the time out of your very, very busy day to come talk to us about it. My understanding is that at the end of the show, we will have some more information on the hotline that people can call. And we'll also put up some information on where they can call to get help if they need it, things of that sort. Do you want to add anything before we end? Any closing statements about this issue?
Well, I really do want to thank you for taking on this important issue. I think it's episodes like this where we're talking openly about this and how we can address this together. It really will take all of us working together, the legislature, state government, Department of Public Health, law enforcement, educators, coaches, parents, friends, all of us working together to stem this tide of this terrible public health crisis.
Well,
so thank you for having me
No, you're
today.
very welcome. And just for programming, since we are going to be having a couple of public safety officials on our next View from the Hill so we can talk about this more locally. And we also are looking within the next 2 to 3 weeks of going into the schools, actually into the Ipswich School District. And we're going to have a panel of individuals, people who have the addiction, family members who have gone through this, and also let people know how they can get help. But more importantly, and I think you touched upon it great, is the fact that you need to recognize the issue.
Absolutely.
You need to accept it, and then we need to get you the help that you need. And today I hope that conversation is just a starting point and not an ending point for us. And we hope to have you back in a few months so you can kind of update us on where we are as a state with all the proposals that have been put forth.
I'd love that. Thank you
That
so
would
much.
be great. So again, to Commissioner Monica Bharel, we appreciate your time. Thank you for coming down. And this has been another episode of A View from the Hill, and we look forward to seeing you in the next episode. Thank you.
Corey, growing up, he loved to play sports, and he had so many hopes and dreams of playing in college. Actually, when he was in high school, he had some college coaches looking at him, and he even had a pro scout that was taking a look at him. He had a torn labrum, and when he had the surgery, he was prescribed Percocet. And he took those for pain, but then the surgery was not successful, so when he went away to college, he realized that all his hopes and dreams kind of had been dashed, and he got kind of depressed when he was on campus, and he remembered that when he took Percocets for shoulder surgery, that they not only made his shoulder feel better, but they made him feel better emotionally, so he started to take Percocet on a daily basis. And then the amount that he took just increased daily, and then he went to Oxycontin and then to heroin.
Little by little, I started noticing that everything in his life that mattered to him in the past, school, relationship with friends and relatives, his girlfriend, hygiene, showering every day and brushing your teeth, none of those things mattered to him. Nothing. And the only thing that mattered to him was the drug.
I knew that there was something different, but I didn't really realize to the extent of what it was. I thought it was more just alcohol and, him having a good time being away at college. I never in a million years even gave it a thought that addiction would creep into his world. Not that I ever thought, not my kid. I never thought when he took those meds after surgery that they could lead to an addiction for him.
Addiction is a disease of relapse. And then the second relapse came, and then the third, and then we realized, I think we have a major problem here.
He had been clean for 75 days, and my phone rang on July 15th, 2013, and it was his roommate. And, he told me, I'm sorry to tell you, but Corey's relapsed, and he's overdosed. The overdose has left him with a lot of disabilities, and they think that he went about 2.5 minutes or so without any oxygen, which led to the disabilities that he currently has, motor skill issues, walking issues, speech issues, and he suffers from what's called cortical blindness.
I think about things differently now since my accident, but before then, I couldn't think of anything else but getting the drug.
What people don't realize is that one of the biggest killers of our youth today is sitting in our medicine cabinets in our home.